Well, our health is under greater challenge than ever before. We have an explosion of environmental pollutants and toxicity. Our water quality is poor. Our food quality is exceptionally poor. The list of chemicals, carcinogens in our food supply is growing, and the exposure time that we're experiencing is growing. So, for example, while we as adults have a certain exposure time to these pollutants, I'm really deeply concerned about our children and our grandchildren. As I sent my son off to college, I realized firsthand, going to the cafeteria there, what they're really being fed. And it's really gone awful poor relative to the way we used to eat, even 30 years ago. So the level of toxicity is high. On the purely what you're taking in, our systems are not working as well as they're meant to work. So our ability to eliminate things from our skin, our ability to eliminate things from our toxins from our breathing. Why? Well, we've forgotten how to breathe. Why? Because we're breathing such polluting air. One of the reasons we're breathing polluting air, and our efficiency of breathing is not the same. Our skin, well, we're busy taking deodorant, so we don't sweat. Sweating is not good. Well, sweating is one of the amazing adaptations to reducing our heat, but also reducing our toxic levels of things that we need to eliminate from our bodies. Well, those are no longer cool. It's something that we have to get rid of. So we're educating ourselves. We're becoming much more modern, but our bodies are not adapted to that level of modernity. And then, on top of that, perhaps the greatest toxicity is that we're having on the effects of our emotional state and our behavior on our biological state. So what I call the bio-emotional terrain is so polluted. We're bombarded with information, mostly negative information. We're bombarded with fear and with worry and with concern, with anxiety and so on. That leads to a chronic overstimulation of our stress axis to a level that I don't feel has ever been measured before. And I think the sum total of this is worrisome. And that is why we're having the explosion of chronic disease today. That is why our current medical system, which is very technologically advanced and suited for acute illness, falls apart when trying to not only explain the etiology of chronic disease, but also having a coherent way of treating it as a system, because in fact we haven't experienced this level of disharmony or dysregulation before.